Unity 4, Antipsychotic Medications. Module 4.2, EPS, Tardive Dyskinesia, and Neuroleptic Malignant Syndrome. This module covers serious neurological side effects caused by antipsychotic medications, including extrapyramidal symptoms, tardive dyskinesia, and neuroleptic malignant syndrome. The focus is on early recognition, differentiating these conditions, and taking immediate nursing action, making this content a high priority for NCLEX and patient safety. Most antipsychotic side effects occur because of dopamine blockade, particularly in motor pathways of the brain. Understanding this helps nurses recognize and respond to symptoms early. Extrapyramidal symptoms, or EPS, are common movement-related side effects of antipsychotic medications. Although EPS are usually not life-threatening, they can be highly distressing and require prompt nursing recognition and intervention. Types of EPS include acute dystonia, which presents as sudden, involuntary muscle spasms and is most concerning when it affects the neck, jaw, eyes, or tongue due to the risk of airway compromise. Akathisia is characterized by intense inner restlessness and an inability to sit still. Pseudo-Parkinsonism may appear as a shuffling gait, muscle rigidity, tremor, or masked facial expression. EPS most commonly occur early in treatment or following dose increases, making close nursing observation essential during these periods. EPS may be managed by adjusting the antipsychotic dose, switching medications, or adding medications to treat symptoms. Common treatments include antiparkinsonian agents such as tresifenidal, Artane, anticholinergic agents such as benztropine, Cogentin, and antihistamines like diphenhydramine, Benadryl. Recognizing EPS early allows nurses to intervene promptly and prevent unnecessary patient distress. Tardive dyskinesia is a late-onset movement disorder caused by long-term antipsychotic use. It presents with subacute dystonic movements that are involuntary and repetitive, such as lip smacking, tongue thrusting, chewing motions, excessive eye blinking, or grimacing. TD may be irreversible, making early detection and routine screening essential. Nurses should routinely assess and document abnormal movements using structured tools such as the AIMS, Abnormal Involuntary Movement Scale, particularly to assess and monitor for tardive dyskinesia. VMAT inhibitors, including valbenazine, Ingreza, dodetrabenazine, Austedo, and tetrabenazine, xenazine, may be prescribed to reduce symptom severity and slow progression, but they do not reverse or stop the progression of tardive dyskinesia. Neuroleptic Malignant Syndrome, or NMS, is a rare but life-threatening neurological emergency caused by an adverse reaction to antipsychotic medications. Rapid recognition and immediate nursing action are critical to patient survival. NMS is characterized by severe muscle rigidity and hyperthermia, along with autonomic instability, which may include unstable blood pressure and heart rate. Patients may also develop delirium or altered mental status. As the condition progresses, NMS can lead to respiratory failure, acute kidney failure, and coma, making it a true medical emergency. Laboratory findings in NMS typically show markedly elevated creatinine phosphokinase, or CPK, due to muscle breakdown. This elevation helps confirm the diagnosis. Nursing action: stop the antipsychotic immediately and initiate emergency medical care. Treatment of neuroleptic malignant syndrome begins with the immediate discontinuation of all antipsychotic medications. This is a medical emergency that requires rapid escalation of care. Patients with NMS require admission to the intensive care unit, where treatment focuses on managing life-threatening symptoms and preventing complication. Severe muscle rigidity is treated with muscle relaxants, anti-Parkinsonian medications, and benzodiazepines to reduce stiffness and agitation. Hyperthermia is managed with antipyretics and aggressive cooling measures. Unstable blood pressure requires circulatory support, including intravenous fluids and vasoactive medications as needed. If respiratory failure develops, patients may require ventilatory support. NMS can also cause renal failure secondary to rhabdomyolysis, which is treated with aggressive intravenous fluid resuscitation and, in severe cases, dialysis. EPS usually appear early, TD appears late, and NMS presents suddenly and severely. Knowing these differences helps nurses act quickly and appropriately. Early recognition, routine assessment, and prompt intervention are essential to prevent long-term harm or death from antipsychotic adverse effects. In the next module, we'll focus on clozapine, a medication with unique benefits and critical monitoring requirements.